So there's many different causes of low testosterone in men in general. The one that we talked about a little bit ago was cortisol. So that stress hormone, being very stressed, can actually divert your hormones away from testosterone. Adrenal exhaustion. Adrenal exhaustion, which kind of plays along with the lines of the stress hormones. Looking at other hormones, dopamine and prolactin, these hormones can be out of whack, which will affect your testosterone. So once again, if that's the reason why, then we gotta go down further the rabbit hole to figure out what's going on. Obesity is actually a big problem as well. If you're excessively obese, you're actually taking your testosterone that you have, and maybe the little bit that you're having, you're converting it into your estrogen via an enzyme called aromatase, which we'll actually spend a little bit of time today about talking about. So that's something that we really want to modulate. Other causes of low testosterone would be damage from toxins, your environmental factors, chemicals of that nature. Another one is taking your testosterone and not keeping it in its normal form and turning it into something else. And this is through 5-alpha reductase. This enzyme converts your good testosterone into DHT, it's called, and DHT can be responsible for hair loss and kind of male pattern baldness along those lines. Once again, there's that sex hormone binding globulin, or as I keep calling it tonight, Pac-Man. Different nutrients deficiencies, and just a lack of sleep, or that insomnia. And it's important to note that with the insomnia, if you're not, just like an Energizer Bunny, the Energizer Bunny needs to recharge his batteries all the time. Or if we're on the computer and it's acting up, we hit the reset button and it will come back on and functioning properly. So we need to make sure that we're getting enough sleep. So just going a little bit of the causes, these are just some chemicals that are found in everyday things that can actually cause low testosterone. Benzophenols, which are commonly found in sunscreens, can actually cause low testosterone. Phthalates, which are found in pretty much a lot of different things, including toys, air fresheners, plastic containers, etc., can cause problems with male hormones. And bisphenol A, or BPA, which has the kind of estrogenic properties, which are the female hormones. It has a high testosterone, you're going to have lower estrogen, or vice versa. You have high estrogen, which is a female hormone, and low testosterone, which is the male hormone. It's going to kind of be the opposite effect. So this is just, once again, kind of another study just kind of looking at chemicals that can cause low testosterone. This one is just simply stating that fluoride, which is in all of our drinking water for the most part, can actually cause low testosterone. So it's just something to be aware of. There's not necessarily stuff that we can do, but if we give the body the proper diet and nutrition and the basic foundation, you can actually affect how your body deals with fluoride or the other chemicals and constituents, so your body can eliminate them and keep doing the functions that it needs to do. So I usually don't publicize books or anything like this, but this book was called Overdose America. It's actually written by a medical doctor. It looked at our counterparts, women, pretty much from the 60s with the estrogen replacement therapies, or hormone replacement therapy, which that HRT stands for. And they found that while they were giving these women exogenous estrogen, they were more prone to having breast cancers and kind of different hormonal problems. And the problem that comes into play, or why I'm mentioning this here, is with all this new information and all these new commercials about androgel and giving testosterone, we necessarily don't know the long-term side effects of it yet. We don't know if that's going to be one of the causes to prostate cancer, to testicular cancer, to any of the male hormone or male conditions that would be from the hormones. So it's just something to think about. It's actually a really easy read as well, if you guys are interested. So androgel, it's one of the methods that you can actually get testosterone. It's a synthetic prescription drug that you can put right on your skin. But it's interesting to note all the different side effects. So just like the commercial, this can cause nausea, vomiting, headache, dizziness, hair loss, trouble sleeping, change in sexual desire, redness, swelling of the skin, change in skin color, and acne. But it's not done yet. Breast pain and enlargement, swelling of the feet and ankles, weight gain, slow difficulty breathing, weakness, and to top it off, change in size and shape of testicles, testicular pain, stomach pain, liver failure, and calf tenderness. So a whole bunch of, not necessarily the best things that you want going symptom-wise, what you want in your body. So this is something that necessarily we don't use as naturopathic doctors. We always like to use the whole plant or the whole vitamin or the whole mineral in its active form. And we like to use that because that's how it's found in nature. So these chemicals, testosterone or anything that we're talking about in nature is in that plant for a reason. It's in that plant to balance out functions. And if we take a look from the heart medicine, cardiovascular disease, take a look for that world. There's a drug back in the day before beta blockers came out. And beta blockers are one of kind of the first line treatment modalities that we use for controlling blood pressure, or at least our allopathic counterparts. So before that, there was a drug called resberatine, that's I can never pronounce for some reason, which is actually an extract from a plant that we actually use in naturopathic medicine. But they just take that one chemical constituent and they give it in a pill form to a patient. They notice all these weird side effects, just kind of like the side effects here. But that chemical constituent, when it's found in the plant has a way of balancing it, and you don't get the side effects, but you still get the benefits. So what can my COE physician do to increase my testosterone? Well, just like in the Matrix, we can't do anything. We can only show you the door. You're the one who has to walk through it. We can give you all the information. We can tell you to eat right. Here's your diet. Here's all these supplements and minerals. But if you don't do anything with it, we're not going to be there forcing it down your throat. So you kind of have to want to take charge. You want to take charge of your health, and you want to make sure that you're there later on in life. And this kind of goes along the lines of the saying that Dr. D'Adamo always says, if you're trying to build a bridge and you're going over a river, I can take all these vitamins and minerals and supplies and I can throw it into the canyon to try to build my platform. But if I don't have that basic structure, that basic foundation with the bridge trestles, diet, exercise, kind of your lifestyle things, those vitamins and minerals might not be as effective. So you need that basic foundation. That basic foundation comes with our relationship of trying to work on your diet, exercise, sleep, etc. So some different treatments that we'll be talking about in regards to low testosterone or andropause. We're going to talk a little bit more briefly about the genotype diet, a little bit about exercise, a little bit about sleep, a little bit of information about aromatase inhibitors, a nice little talk about tom-cat-ali, which is a very effective herb, some different vitamins and minerals, and ashwagandha, which is another herb. And during this time, I'll have a couple of different products in there that have some of this stuff, have some of these things in it, and we'll see. So a little bit about the genotype diet. We all kind of, at least somewhat familiar with it. It goes along the lines of, it's based on the blood type diet, which was developed by Dr. Peter D'Adamo and Dr. D'Adamo's father. The book was originally published, I believe, in 1996 or 96? Okay, so around that time, 1996. And the way I usually like explaining it to people is via trying to reduce inflammation. So you hear the word a lot, lectins bouncing around, but pretty much we're trying to reduce inflammation, something that you do every single day, and that's eat. We hopefully all eat 3 times a day at least, good healthy food according to your genotype. And we're trying to, with the diet, we're trying to give your body what it needs so it can do the job and functions that it's supposed to do. This includes vitamins and minerals, which are normally found in our food, and cellular detoxification. So if we give the body what it needs, it's also going to eliminate what it needs. So you don't have that toxic buildup of chemicals and the BPA and the fluoride water and that kind of stuff. So by giving the basic foundation, building that bridge properly, your body's able to process stuff when it comes about. So this is just a little bit of study. This one's actually not on the blood type diet, but it is just saying that if you eat a healthy diet, you actually can increase testosterone and decrease some of the sex hormone binding globulins. So everyone who's ever gotten a genotype diet, when you leave the office, you get 2 binders. One of the binders is all your recipes that you can use, so it has top 100 recipes. And the other side of it, we have your individualized foods that you can eat. So what kind of meats you can eat, or what kind of vegetables you can eat, or what kind of spices you can use, and that kind of stuff. And at the very end of the book, there's a section for exercise for your blood type and your genotype. So generally speaking, type A's usually do a little bit more, usually a little better with meditation and calming exercise, Pilates, yoga, Zazen, Kokuhol, any of those kind of exercises that you want to do. While someone who's blood type O usually does a lot better with getting up and moving and exercising very hard, rapid kind of aerobic exercise. And this is just kind of looking at if you exercise in 200 minutes a week, it can produce greater improvements in your functions of testosterone, and it also can decrease your fat mass. So if you decrease your fat mass, you're going to decrease your estrogen, generally speaking. So exercise is very, very important. And it's Dr. D'Adamo was saying last year when we were still doing the private shifts that there's a couple of different studies that came out that if you exercise 20 minutes a day, 5 days a week, and add Is it 5 to 7 years to the end of your life expectancy. If you get up and just walk 20 minutes a day, can add that much on you because you're actually taking charge of your health and you're actually doing something to better yourself. Sleep, we were talking about Energize the Bunny just a little bit ago. It's kind of your chance to reset, recharge, give your body the proper energy it needs to do the functions that it needs to do. This study is just pretty much showing that if you have enough sleep, you're going to have a proper balance of sex hormones, male hormones, testosterone. Alright, so we're going to spend a little bit more time here, but this is aromatase. So this is an enzyme that we look at when we're trying to modulate testosterone. So normally we have all this testosterone over here, and then somehow it gets converted into this estrogen. And as a man, we don't necessarily want all this estrogen. We want to keep our testosterone nice and high over here and estrogen really low. So this enzyme actually pushes the testosterone into estrogen. So aromatase is an enzyme found in the liver that converts testosterone, male hormone, into estradiol, one of the female hormones for the most part. So there's many different natural aromatase inhibitors, which is that enzyme. In the allopathic world, they kind of use one that's called finasteride, or is Proscar, which is one of their aromatase inhibitors. But just like we were talking about the cardiovascular medicine, there's side effects associated with it because you're just using one little tiny chemical and not the whole plant, not the whole picture. So as NDs, or naturopathic doctors or naturopathic physicians, we always use natural modalities first as a first-line treatment. They're least invasive, and we actually usually get a lot better results than them. These natural therapies are more effective, and there's usually less side effects. So let's take a look a little bit further into aromatase inhibitors. So a few natural substances. Indole-3-carbinol is a scientific name, but it's a chemical that's found in our food. It's found in our cruciferous vegetables, or cabbage, or Brussels sprouts, cauliflower, broccoli, etc. And this actually helps that conversion to keep the testosterone high and decrease that estrogen. And this is something that we use a lot when we have women who are going through different hormonal changes. We use something called DIM, which is it's indole-3-carbinol here, DIM is here. This chemical that's in these foods is more indicated for men, while the DIM is a little bit more indicated for women for processing those estrogens in the liver. Chrysin, which is a chemical from passion flower, which is a normal flower. You actually go out into the garden right over here during the summertime, and you can kind of see these big old bumblebees kind of sitting in the flower, kind of chilling out a little bit. This has actually been shown to be an aromatase inhibitor. Once again, for a natural world, being able to keep the testosterone high and the estrogen lower. And has been shown actually to be as comparable and more effective than pharmaceutical grade aromatase inhibitors just by the plant action. Apogenin, which is from cadmiol, which if you ever read the book or had your mother read the book for you growing up, Peter Cottontail, when he was out playing in the woods and all that kind of stuff that kids do, playing in the mud, getting scraped up, that kind of stuff, he came back home and he was very tired. Well, his mother actually gave him cadmiol tea. And cadmiol it does many different things. But one of the things that it does is actually been shown to be an aromatase inhibitor equal to the last one we were just talking about, chrysin, which was found in the passion flower, which was found in the passion flower, and one of the passion flower has been shown to just be effective as the pharmaceutical grade agents. And then just again, the last thing that we're going to talk about in this little section is isoflavonoids, which are from the plant soy. Two chemicals in the soy that actually have aromatase inhibition effects, the genistein diazidine. So Dr. D'Adamo actually came up with a formula that kind of balances all these different chemicals and within their plants to have a beneficial effect and to avoid any of those side effects. And it's actually called Aromostat. You can see up there from the supplement facts that many of the things that we talked about are up there, and actually including one which I didn't talk about, the spice turmeric, which you actually can be found in your spice rack. You might use it on different foods and that kind of stuff. It kind of reduces inflammation, so kind of reduce pain. But Aromostat is an all-natural blend of herbs shown in clinical studies to inhibit the enzyme aromatase. In men, aromatase activity increases with age, converting what little testosterone that is left into estrogen. It is perhaps this event that is most responsible for the many symptoms of male menopause, and possibly even enlarged prostate and prostate cancer.